I'm sure a lot of you have seen the post from my colleague Elisabeth Potter about having to leave the operating room to talk with an insurance company about her patient's need to stay a night in the hospital. And there's been an update to this situation. So the United Healthcare lawyers have now sent her a cease and desist, claiming very predictably that she, in fact, did everything wrong. They never asked her to leave the operating room. She submitted things incorrectly, and it is, in fact, her fault the patient wasn't approved. So I find this really interesting. So they certainly didn't tell her to leave the operating room, but they put in place systems that required her to do so that her patient who was having surgery got the appropriate care and wouldn't be charged probably hundreds of thousands of dollars for it. It's like completely missing the point of her video and just nitpicking little things to try to save face, when ultimately they put in place systems that require physicians to jump through insane hoops to get obviously appropriate care for a patient. And I can't believe these monsters think they can silence us by sending a cease and desist. No, United Healthcare, you absolutely put in place the systems that require us doctors to do ridiculous things to advocate for our patients. You did that. This is because of you. And you did that because you don't want to cover care. You want to make your billions of dollars in profits while the people that pay monthly fees to have health insurance get denied life-saving and life-altering care. So I hope everybody will continue to boost content of physicians and patients that are sharing their stories about the ridiculous things that health insurance companies require us to do to care for you. And I hope everybody supports Dr. Potter through this crappy time. It's really scary, I would imagine, to get a letter like that. And we all have your back, Dr. Potter, and I hope the American Society of Plastic Surgery supports you through this because it's not okay. And one more thing, I always get these comments every time I make a post about insurance. No, your insurance company making billions of dollars a year isn't there to protect you from needless care from your physician. That is just a stupid assertion. And you really think a bunch of non-medical people making money off of denying you care are the right ones to figure out what appropriate care is? Come on.